cause this is my road. Lights, camera, action, I'm ready to go. I'm never gonna give up, fall down, I just gotta get up, hey. Yeah, this is my road. Lights, camera, action,
I just want to welcome you today to the Tom Ficklin Show on WNHH Radio. I am overly excited because I have the opportunity to introduce to you some very dynamic people that work right here in your communities. One of the people that I've known for quite some time, over 11 years, and the very reason that I actually came to Connecticut is because of the influences of this man that I'm about to introduce to you now. He's not only a good friend, somebody that I learned so much about ambulatory care, serving this community, just sitting in a room with him, listening and worshiping him as he spoke and speak to all of you out here in the community. I've learned so much from him. I'm going to introduce you now to my good friend, Mr. Michael Taylor, the CEO of the Cornell Scott Hill Health Center. Mr. Taylor, is just, I don't even know where to begin. I'm just so excited.
First of all, you didn't tell me you were going to make me blush. That's number one.
Another opportunity just to have him on the call. This is a very busy man, and the work that he has to do in running one of the largest FQHCs, not only in the state of Connecticut, but one of the best FQHCs throughout the country. And the work that they have done in this community is tremendous through the leadership that he has provided in his time. I guess our time was pretty much the same at the Cornell Scott Hill Health Center, but since that time, the things that they have done. Mr. Taylor, I don't want to hold things up. I kind of want to turn the mic over to you just to kind of tell us where the Cornell Scott Hill Health Center is going, some of the things that you got going on right now, and the commitment that you've already made and the commitment that you look forward to making in the future for the very residents of this community. Mr. Michael Taylor.
Thank you, Bernard. It's really wonderful to see you again. And I had forgotten that we go back so far. And remember, now that you bring it to mind, your arrival in Connecticut. So glad that happened. I'm going to start, as it pertains to the health center, I'm going to start where I always start, and that is with our mission. And that is to improve the well-being and the health of the community and the communities and the people that we serve. That's our rock, that's our foundation, it's our goal. All the while being compliant with all the appropriate regulations, rules, and so forth. And so we are extraordinarily proud and pleased to serve the New Haven community. It is indeed an honor for all of us, and we take that very seriously and carry it every day. And so that commitment that we have has really taken our organization quite far, to date, I will say. And interesting to me to see these census results being published yesterday, because they show something that we felt all along, and that isn't the increase in New Haven residents, in the number of New Haven residents. We've seen this sort of incrementally over the past several years as our patient population has grown quite considerably, and we now serve almost 55,000 patients a year. I know it was a fraction of that, Bernard, when we first met, but I think it marks the progress of the organization and the needs of the community that we care so much about. So a number of things have occurred along with that growth. We have been on a path of expansion to meet the increasing demand. That's included a lot of things, very specifically, and examples of that, of growth is we have renovated, are in the process of renovating and or replacing and expanding and adding more care sites. We will bring 4 additional care sites online by the end of next June. We have completed a rather extraordinary and groundbreaking collaboration with the New Haven Hospital at Sargent Drive and with Fairhaven. Thrilled to be partners with those two wonderful organizations. And all of that has led to growth of the Cornell Scott Hill Health Center and we're really quite thrilled about that. We are committed to providing optimal access and the highest quality healthcare for our patients, and that's very important to us. Equally important to us is the people, now 650 people, who work as part of the Cornell Scott Hill Health Center organization. That number is daunting to me because I remember a time when I literally knew everybody by name, and I can't say that anymore, and that's disappointing. But we've just gotten so big. We think that our growth really is very much fueled by the people who are just astounding. Our people are just astounding. And so when the organization grows and does well, we think it important that the people who are the Cornell Scott Hill Health Center grow and do well with us. So I'm really proud to announce that in July, we increased our minimum wage to $18 an hour. That's several years and several dollars ahead of and above what the state minimum, but we're very pleased about that. And we think it allows us, it is consistent with our mission to improve the well-being of the community because people need to be able to sustain themselves. So we're very proud of that. There is so much more on our horizons. This is a celebration of Health Center Week. We regard Health Center Week as a rededication of ourselves to the people and the communities we serve, and that's what we're all about. So formally, New Haven, the Cornell Scott, on behalf of the Cornell Scott Hill Health Center, we rededicate ourselves to you to pledge our earnest best to do everything we can to improve your well-being and improve your health.
You know what? I'm gonna tell you, because of people like you all, Mr. Taylor, and I want the New Haven residents to understand the importance of this. Because of the leadership that Mr. Taylor has provided to this community, it's people like the next very person I'm about to introduce that you have an opportunity to receive services from, and that is no other than Dr. Levita Robinson. Dr. Robinson worked directly with me for 4 years at the Dixwell office, at Dixwell Health Center at 226 Dixwell Avenue. If some of you didn't know that, she is one of the people that I look at and look forward to working with, because I know that she really cares about the very patients she serves. And it's because of the leadership that Mr. Taylor has made that we were able to bring such people like Dr. Robinson to provide care for you in your community. Dr. Levita Robinson is a giant when it comes to providing healthcare services to this community. I know because I sat right beside her for quite some time, watching her work with her patients. She's also part of a very exclusive program that we collaborated with Carla Estelle Bragg, which is the director over marketing for Cornell Scott, marketing and communications for Cornell Scott, and it's called Let's Talk About It, where she comes on the call and gives you all the important information and answering questions that you have as it relates to this pandemic that we've been in for the past couple of years. And it's important you hear this, because a lot of the hesitancy that we deal with is due to a lack of information. And because we have people like Mr. Taylor, because we have people like Sarah, and because we have people like Dr. Robinson to provide you that very information that you need. So I'm going to ask Dr. Robinson just to come in and introduce herself unto you and kind of just give you her feedback as it relates to why it's so important that we get vaccinated. Dr. Robinson, come on in, talk with us.
Hey, Bernard, thank you. It's so great to see and hear your voice again. I'm very honored to be included in this program, and you know, it just gives me joy and pleasure to make sure that I'm informing everyone about what's going on, keeping people up to date so that they can stay informed and ultimately stay healthy. You know, I think one of the things that we realize is that these are very challenging times. But, you know, when we look back at when we think about the COVID pandemic in general, and we kind of look back to where things were over a year ago, I mean, it was a very dire situation. And right now, we're at a point where we actually have the power and the ability to prevent this pandemic from getting much worse through the power of vaccinations. And I think sometimes it can be hard to remember what it was like in the very beginning of the spring of 2020, just how scared everybody was. We didn't have any treatments. You know, it was one of those things where if you got an infection, we weren't sure, you know, which direction you were going to go. And that still can be the case if you're not vaccinated. But now we actually have vaccinations which can prevent hospitalizations and serious illness and deaths. And so now that we're armed with that, we want to make sure that everybody has the opportunity to become vaccinated. And if they have questions about vaccines, we want to make sure that we're arming them with that information as well.
Wow. I'm sorry. Go ahead, Dr. Robinson.
Yeah, I was going to say, you know, I think one of the things that, you know, one of the things I always like to tell people about is that, you know, I'm thinking about in the beginning of this vaccine rollout, you know, as a community health center, we want to make sure that everybody, you know, has access to vaccinations, but we also want to make sure that people in our surrounding neighborhoods, including those that are patients of Carl Scott, who see us time and time and again for routine healthcare, we're also not left out. And so, you know, I can recall in the beginning of the vaccine rollout, we had people from all over the state. We still do have people, you know, from all over the state that come to get vaccinated, some from even the farthest corners of the state. But we also have been really intentional about making sure that our own neighbors that, you know, live right down the street, that live in our communities, we want to make sure that they also have access as well too. So whether or not that's somebody, you know, themselves coming to us and requesting a vaccine appointment, or whether that is, you know, us having, you know, our own healthcare providers or people from our team reaching out to patients who haven't been vaccinated, and just letting them know, you know, right now we have a strain of COVID that's a lot more contagious. Unfortunately, it's almost twice as likely for someone to be hospitalized if they get infected with the Delta strain vaccinated. And we have vaccines that can prevent all of that. And so we want to make sure that people know that information and that they can get vaccinated to, you know, help protect themselves and also those around.
When you think about all the rumors, Dr. Robinson, that are out there as it relates to COVID, that helps people to kind of fall behind the hesitancy, kind of how do we get around all the rumors to kind of get people to see what's actually important as it relates to getting vaccinated?
Yeah, you know, I think, you know, I think that does make things a little bit challenging. You know, nowadays, you know, we have access to a lot of information, you know, through social media, through the internet. But sometimes, you know, we have access to information that may be incorrect. And I think that's what makes it a little bit challenging, because if there's some correct or false rumor that's out there, and then it gets spread, and then it, you know, sometimes it can be hard to kind of put out that fire once the match is lit, so to speak. But I think one of the ways, you know, when I have my own patients and we talk about vaccines and what's in those vaccines, how they work, et cetera, a lot of times I'll ask them like, hey, where are you getting your information from? Because I'm just curious. And so if somebody tells me that they're getting their information from Facebook, well, you know, is it a news source on Facebook, or is it just, you know, somebody writing their opinion? So I think a lot of it is that we have to also look at, okay, where are we getting that information from? And that's why, you know, in this situation, if you have a primary care provider, reaching out to them with any specific questions can be very helpful, especially if you have a question about your specific concern. With that being said, you know, you and I, we've held some of these town hall meetings where people have had an opportunity to ask very targeted questions that they can hear from a healthcare professional. So I definitely, you know, strongly recommend that somebody reach out to a healthcare professional, even at our vaccine clinic. So for example, the vaccine clinic held here in Well, I'm the lead physician that kind of, you know, is oversees that. So we have had patients come in who have had a question about something. Oh, I had this vaccine before, and I'm wondering if it's safe for me to get. And I've actually have sat down and talked with people, you know, had conversations with them about some prior vaccines that they had, and whether or not it's safe to get the COVID vaccine. In all of those situations, you know, there wasn't any contraindication. But just knowing that you can have those types of with the healthcare professional, I think, you know, makes things a little bit, will put people are put at ease with that. So I would say definitely making sure that you're getting that information from a trusted source, and not just from, a post on social media where maybe we can't track down who, like, the original source of that information.
As Mr. Taylor had already mentioned, the collaborations and kind of renovations and a lot of things that they have done and expansions, it's so very important that you know that you have places you can go. You have clinics that are all throughout the city, and Cornell Scott is definitely involved in making sure that you have an opportunity to get vaccinated. The next person that I just would like to bring along into this conversation is a person that's actually out there doing outreach in this community, providing services to you that you have a place to go to get vaccinated. No matter where it is, Cornell Scott is willing to be there. And I like to bring Sarah Killing onto the call so she can just tell you the work that she actually does and places that you may be able to go so you can get vaccinated. Sarah?
Absolutely. Thank you for having me. And I'm definitely very honored to be here. I think just kind of a little background on what we've been doing. Since December, we've been kind of trying to really focus our vaccination efforts on our community and on our local residents. So we've done over 42,000 vaccines throughout the area at this point, which is awesome. And something else that I kind of put together today is that we've done almost 19,000 of those off-site. So between our mobile van, which has given about 5,000, and Wilson Library and Hampton Board of Ed, we've been kind of all over the place and trying to make sure that we're getting these vaccines out into the community. So almost half of the vaccines that we've given so far have been in locations that aren't our typical Cornell Scott brick and mortar foundation. So, really excited that we've been able to get out into the community and really focus our effort and pop-up clinics, and not just vaccination, but the education. So along with what Dr. Robinson was saying, just making sure that we're available to answer questions from a trusted provider, to be able to help with some of that misinformation, and to make sure that our staff is willing to sit down and answer those questions and not be pushing people through. We're really proud to say that we will take the time to answer whatever questions you may have, give you the options. We have all 3 vaccines available. We want you to know what your choices are. We want to empower our patients to make a decision that's going to work for them. And right now we're hoping that we're going to push people to get vaccinated, because that's our way out of this. But just to make sure that we're giving the best education we can at every event and every opportunity that we're out. Most of our events, at the beginning were church, small community events, and now we've grown into some excellent collaborations. Thank you to Bernard and several other community members, but we really do have a good group here in New Haven that meets regularly about all of the vaccine events that are going on in the city, to make sure that we are targeting the right areas and neighborhoods that may need a little more extra education and extra outreach efforts, and kind of giving some people a break too, because we know that we've been kind of overwhelming the community, knocking on doors, and just making sure that we're still available without overdoing it. That's mostly a general overview.
That is a great overview, actually. As I think about this thing, Mr. Taylor, I want this community to know actually how many years the Cornell Scott Hill Health Center has actually been providing care. I think we're right at 52, 53. I think we're close to that area. Am I close?
It was founded in 1968, so we're closer to 55.
Closer to 55 years of committed excellence to serving this community. Mr. Taylor, if you had an opportunity for the very ears that's hearing your voice right now, what would you say to this community as it relates to the Cornell Scott commitment to providing the best medical healthcare services to them? What would you say to this community if you had that opportunity, like now?
I think that if you were with us earlier and you heard Dr. Robinson and you heard Sarah, they are very much reflective of our organization. There's extraordinary expertise, but there's also heart like you can't imagine. So I guess And that sort of oozed out of both of them, unmistakable. And that's really very much reflective of the entire organization. When, we talk about us caring to keep you well, we really do care to keep you well. We're very fortunate that we also have the expertise and the knowledge to do that. And we just keep getting better every day. And so we are very appreciative of the support the New Haven community has given us to enable us to serve. It is our honor. And those of you who are still hanging out there without a home, a medical home, a behavioral health home, please come and see us. We care to keep you well.
And that's part of that hesitancy that bothers me, is that people don't have the information. And because they don't have the information, they have the excuse not to pursue quality health care. And I want them to know that the Cornell Scott, just as Mr. Taylor just told you, just as Sarah has already told you, and just as Dr. Robinson has told you, you have a home to go to that's fitted just for you. I'm not just saying it because they're on the call with me. I'm saying it because I worked there for several years at the Dixwell Clinic and State Street Clinics as the practice administrator for both of those centers. And I've seen it for myself. I'm actually still a patient of the Cornell Scott Hill Health Center. This is where I go get my eyes checked every year. So I definitely agree with that. So let me just jump back to you, Dr. Robinson. As it relates to some people not really understanding kind of what's in the vaccines, and because a lot of people say they don't know what's in it and they're going to wait to see how it affects other people, and they're going to wait to see kind of results from those people. Kind of, why is it so important? I mean, first of all, why is it important that they should get vaccinated? Secondly, what's actually in the vaccines? Is it harmful? Is it not harmful? Should they be afraid of getting it? Kind of help them understand those things.
Yes. I think, when it comes to the importance of the vaccines, I mean, one of the things that I tell people is that as far as treatments for COVID, so we do have some treatments out there for COVID, but I like to preface that by saying that they're not cures. And we have one of the treatments that's out there for COVID is an antibody infusion. But already we have shown, or Delta has shown us, that of the 2 antibody treatments that were being given, one of them already we can't even use anymore because it's not really effective against preventing people from who get the Delta variant from getting sicker. So we went from having 2 antibody treatments down to 1. And even with that being said, there is still that chance that someone can get that antibody treatment after they test positive for COVID and still may go on to get sicker. And some people still have died despite that. And so that's one of the reasons why we're trying to prevent you from getting sick in the first place with the vaccine. The other treatments that are available, it's usually 2 medications that are given through an IV, and they're given over the course of several days. And you have to be hospitalized for this to happen. So you've got to be sick enough to be in the hospital. And again, similar to that antibody infusion treatment, I think we all know of people who unfortunately have been hospitalized and didn't make it out, didn't make it out of that situation and unfortunately died from it. And some of those patients received some of these, big gun treatments that we have out here for COVID, and it still wasn't quite enough. And so the idea with vaccination is that let's, kind of prevent COVID from, wreaking havoc on your body before it has a chance to do so, instead of trying to kind of chase our tail and have somebody get infected and then start throwing all these medications and treatments at them and keeping our fingers crossed and hoping, and praying that they work. So that's essentially why a lot of doctors, nurses, healthcare professionals have been really focusing on the vaccinations, because it's the whole idea of like preventing something, right? So I know a lot of times people talk about, well, there's all these medications that are out there to treat illnesses, but what about preventing the illnesses? That's where the vaccines, because the whole point of vaccination is all about prevention. As far as what's in it, there's actually not much that's in it, which so with the mRNA vaccines, which are Pfizer and Moderna, and the Johnson & Johnson vaccines, all 3 of those vaccines, pretty much get us to the same point, which is basically allowing our body to make antibodies, which are like these little proteins that fight off infections. it allows our body to make antibodies so that if you were to become exposed to COVID, whether it's a Delta strain or whichever strain, you already have those antibodies ready to roll and to kind of fight off that infection so that you don't get sick. Now, as far as the ingredients, so with the mRNA vaccines, there's not much in it. So there's the actual vaccine itself, which is this mRNA molecule, which is basically, those are the instructions for our body to make the antibodies. You also have some salts in there. The salts are really there to kind of help with the pH level because you want to have that pH level be close to the pH level of our own body. So the pH level for these vaccines are anywhere from 7 to 8, and our own body's pH is about 7 to 4 of the pH of like the blood and cells in our body. There are sugars in there which allow the mRNA vaccine, so that means the Pfizer and the Moderna vaccines, to keep their shape when they're stored at a low temperature. You have some fats in there. They kind of form like this little fat bubble that helps protect the vaccine from being destroyed as soon as it's injected into the body. And then we have some the fat, one of the main fats in the mRNA molecule is the polyethylene glycol. So, you know, you might have heard that term polyethylene glycol. That's actually a type of fat that can actually surround the vaccine and protect it from being destroyed when we inject it. What's really important to note is that there's certain things that aren't in the vaccine. So there are no eggs or animal products. And that's actually one of the ways that we're able to kind of ramp up production for these things. You know, I would say the example I give is our traditional flu shots. So most traditional flu vaccines are grown in chicken eggs. And so then you've got to grow them in chicken eggs for a period of time, you know, extract them from the chicken eggs, purify it. We don't have to do any of that with the COVID vaccines because there's no animal products that we're using with those. There's also no live virus in the mRNA vaccines. There's no microchips. I know that was some rumor that was going around. There's no preservatives in it. It does not alter your DNA. So I know some people were concerned about that. And there's no human like blood products in it. So those are just some kind of rumors that have gone around in terms of what are in those vaccines. But ultimately, it's the vaccine itself, fats to protect it, salts for the pH, and the sugars to help keep its shape when it's being stored at such a low temperature. For the Johnson & Johnson vaccine, that has very similar ingredients as well too. So you've got the main active ingredient, which, you know, tells your body to create those antibodies to protect you against COVID. You also have sugars in there that help keep it and keep the vaccine in shape. You also have those salts there, which are going to help with that pH level. You have the fatty little fat bubble molecules that help protect it so that when it's injected, it doesn't get destroyed by the body automatically. The one thing that's a little bit different with the Johnson & Johnson vaccine is that it does have an alcohol in it. So it's not like the alcohol that we drink, but what it does is that it helps maintain the temperature. So that's the reason why the Johnson & Johnson vaccine is able to be stored at a higher temperature than say the Pfizer vaccines. But similar to the Pfizer and Moderna, there's no eggs or animal products, doesn't change or alter your DNA. There's no live COVID-19 virus in there. There's no microchips, no preservatives, or no human blood products. Oh, and Bernard, I think your mic can be muted.
You're muted, Bernard.
Yeah, here I go, not even paying attention to myself. But just thinking about the conversations that we're having throughout the state as it becomes to preventive care and wearing the mask, you know, what is kind of your perspective as it relates to quality preventive care and what people should actually be doing to, you know, to keep themselves safe? Should they wear the mask? Should they wear a double mask, inside or outside? Because that's a big conversation within the state and within our city right now. What would you say to the community about wearing a mask? Yeah,
so I mean, I think, you know, as a medical professional, I definitely typically follow the CDC guidelines. So, and sometimes I know people have kind of, I've heard, you know, little rumors of people saying, well, they kind of change their position every week. It seems like there's always something new that they're saying, like, you know, how do we know, like, you know, if we can even really rely on what the CDC is saying? But, you know, to that, I usually would say is that part of the reason why the position may seem like it's changing all the time is because this virus is changing, right? So I don't think any of us, would have imagined that we would be where we are today. But as this virus kind of changes with time, then we have to change what we're doing to kind of keep it at bay and prevent it from getting any worse. So as far as the masking thing, so, I think a lot of us remember when there was that announcement that, hey, if you're fully vaccinated, you don't have to wear a mask indoors. Definitely don't have to wear a mask outdoors. But now we're asking all people, regardless of whether or not they're vaccinated or not, to wear a mask indoors, particularly if you're, in an indoor setting where you're not around people in your own household. So that means if you are, I don't know, like in a museum or some other place where there's other people around that maybe you don't live with, they don't live under the same roof as you. And part of that is because, now we're dealing with a different strain. So before, when we were dealing with a strain called the Alpha strain of COVID, the vaccines were very good at preventing people from spreading, COVID to one another. But now with this new Delta strain, it is a little bit more contagious. And so even though the vaccines are still great at protecting people from feeling like sick with COVID and actually having a serious illness, dying from it, we do know that with the Delta strain, it is more transmissible. So there is that possibility that people can pass it on to one another. And so that's why we're strongly recommending that people wear masks, especially if they're in an indoor setting. Now, if you're outdoor and you're not kind of right on top of one another, and there's wind blowing, you've got good air circulation, in those situations we haven't had any recommendation or guidance from the CDC for people to wear masks outdoors, but definitely indoors, there has been recommendation for that. In terms of the type of mask, so, I think now what's nice is that there was a time when it was really hard to find masks. A lot of it was just let's preserve all of these masks for healthcare professionals, and a lot of everyday citizens were, just using kind of makeshift masks, folded up bandanas, that sort of thing. Now masks are pretty readily available in most places. You can go into any store and you find them there. In terms of the, which ones are better or which ones may be more protective. So we do know that the thinner a mask is, in terms of if it just has kind of a single layer of cloth, that may not be as protective as, say, a mask that has several layers to it. And part of it has to do with the fact that, not only is yes, air can kind of go through there a lot easier, but there may be little pores or holes in that material that's allowing that virus particle to get into, because it's very, very, that virus particle is very tiny. So if you have a mask that has several layers to it, that actually will probably be a little bit more effective at blocking. And then also too, if you're in a situation where multiple people are wearing a mask, that's further reducing the spread of this virus.
The funny thing about it is I was just sitting here thinking as you were saying that, and it made me think about pre-existing conditions that people may come in with. And before we go there, I just want to come to Mr. Taylor real quick, because in his duration at Cornell Scott, they provided and actually established so many different departments into the Cornell Scott that wasn't there before he got there. And Mr. Taylor, can you just take us back to some of the offices that you have actually brought, when you think about preconditioned conditions, medical conditions that you have established in your tenure since you've been with Cornell Scott?
Sure. Before I speak directly to that point, Bernard, Dr. Robinson's comments really made me mindful of something, and that is, in addition to protecting yourself against COVID infection, I have, since the pandemic began, become very concerned about people remaining compliant with their preventive health visits, because we have found that at least some people have fallen out of care, and that's not a good thing. Maintaining your health really does require maintenance. So I want to encourage everybody to keep your preventive health visits. And to make it easier for you, and this comes to your question, Bernard, one of the things that we have established in the organization is significant telehealth capacity. Mm-hmm. So telehealth is available to everyone and now exists throughout our organizations for the vast majority of our providers. We've actually, with the renovation of our Columbus Avenue location, which is our main care site, we've actually established an in-house telehealth center on the second floor. So that's one of the things we've done. So it served the purpose of really keeping people connected to care when they might be apprehensive about being in a public setting. So now you have more than one option on how to access your provider.
There's so much going on at the Cornell Scott Hill Health Center that you didn't know about if you're not already a patient there. And as Mr. Taylor had already put out to you, if you don't have a home, they have a home for you. Everything you need in a FQHC Health Center, they already have.
We are one of the most comprehensive health centers in this country, not just in New Haven or Connecticut, in the country.
And that's just for people just like you. That stems me back to you, Dr. Robinson, as I brought the question up to Mr. Taylor. What pre-existing conditions that people may have in our community, especially among Hispanics and Blacks, that may, if they're not vaccinated, can actually be a problem?
Yeah, so I mean, I think to kind of piggyback on what Mr. Taylor was saying about the need to just have your routine health appointments. Even there have been actually the American Cancer Society has actually looked at this and looked at how there's been a steep drop off in the number of people that got routine cancer screenings, like your basic mammograms, your colon cancer screenings. For women, cervical cancer screenings. And they looked at the numbers in some, major cities in the Northeast. They looked at those numbers. Okay, how many people were going for this on a yearly basis before the pandemic, like 2019? And then what has happened since the pandemic? And those numbers were pretty shocking. In one city, they went from one particular hospital went from having maybe 60,000 people a year going to get these screenings, and that dropped down by 75%. And you can imagine that if you're not getting, routine health checks, something could get missed or something, God forbid, gets detected at a much later stage. And one of those things we worry about are certain types of cancer. So we definitely want to recommend people that if they don't have a healthcare provider, to reach out to get connected, so that you are making sure that you're getting your routine, health screenings, but also those health screenings would involve routine cancer screenings, depending on what your age is. As far as what are some of the pre-existing health conditions? So I would say one of the some of the main pre-existing health conditions that could allow someone to have maybe a worse case of COVID, should they get it, having any underlying heart conditions, meaning that if you've had a heart attack before in the past, if you have ever had to have a procedure where you had a stent placed in your heart to help with blood flow in the arteries, if somebody has high blood pressure, that in and of itself can increase your risk of having a complication. If you have diabetes, we know that diabetes can sometimes affect your body's ability to fight off infections in general. And so COVID is no different. So people with diabetes are at a higher risk of having complications. If you have any underlying lung issues, whether or not that's COPD, with asthma, just kind of depends on how severe the asthma is, but just having any underlying lung condition whatsoever, if somebody has cirrhosis of the liver, if somebody has a cancer diagnosis, that preceding their COVID infection, I would say those are kind of the ones that just kind of, are off the top of my head. Some people have autoimmune conditions. And so with the autoimmune conditions, the main thing is that sometimes when people have an autoimmune condition, they may be on certain medications that kind of is trying to lower their body's own natural immunity because to prevent their body from attacking itself. But that also may put them more at risk of getting sick with COVID. And also, one of the things that was really interesting in the very beginning of the pandemic, we would sometimes see these stories about people that, were seemingly healthy, that were getting COVID and dying from it, and we couldn't explain why. And some of those people that, otherwise had no other health conditions might have, struggled with their weight, or maybe they were carrying excess weight on their frames. And so in medicine, we kind of use that term as body mass index. And body mass index can be kind of controversial. But what we do know is that if somebody has excess, fat on their frame, it can actually increase the risk of having a complication with COVID. And what we're learning more and more is that the fat tissue that's in our body, it doesn't just help with cushioning us and help keep us warm, but fat can also release something called a pro-inflammatory marker. So excess fat in our body can cause more inflammation, and that can also reduce our body's own natural ability to fight off infection. So there were some research that showed that even before COVID came around, but we're kind of seeing some of that more and more now that is here.
If I may, Bernard, I'd like to add two more factors to Dr. Robinson's list, and one to encourage people to also maintain their dental health, because that too can be a real indicator of and problem for people. And secondly, one of the things we've seen is an extraordinary increase in people's stress level in dealing with all of the ramifications of the pandemic. So we've seen exacerbated mental health issues. We've seen depression increase quite significantly, and also recidivism for people suffering from substance use disorders. And unfortunately, the suicide rate has gone up quite considerably.
And you guys, just because you mentioned that, you do provide behavioral health services out of the Cornell Health Center, correct?
Well, we do happen to be one of the most comprehensive providers of ambulatory behavioral health in the state.
So I just want people to know, if you actually are having issues in that area, especially with depression, Cornell Scott has one of the best behavioral health programs in the country, right here in your neighborhoods, right near you right now. So if you need those services, please with the Cornell Scott Hill Health Center in that area. We are once again on the Tom Ficklin Show, 103.5 FM, WNHH. I want to come to you, Sarah. Sarah, I was just thinking about kids going back to school. And there's a lot of concern. And as you know, in the news right now, there's a lot of concern about what services are going to be provided to children going back to school. And I understand that you're right at the center of school-based health. Just kind of give the community just some updates and guys, kind of what you guys are doing in that area.
Absolutely. This is another one of those areas that I think has really shown that the community is coming together a lot better than it has in the past. So we are already starting to meet weekly with all of the community partners with school-based health centers. So we have multiple schools in New Haven, but so does Yale, so does Fairhaven. And in the past, we've kind of all just done our own things when it comes to back to school. However, this year we are really trying to work together to make sure that every school has some way of accessing COVID-19 vaccinations coming back to school. So for Cornell Scott, we will be making sure that all the schools that we have, health centers that will have access to the vaccine, but then there are schools that don't. So we're making sure that throughout the city that someone is going to be there, and making sure that we have access for everybody. So we will probably be in new locations and around the city, especially. We have something mobile going on every single day of the month for August, and we're already booking up most of September. So you'll see us at all the back to school fairs that we possibly can get to, and any of those events, because our vaccination is really still the best way to stay healthy right now.
Communication is so important. And now that you mentioned that, how can people connect with you? Do you have a website? You have a phone number that you can give out so people can actually call if they wanted to set up a clinic and things like that? How do they reach you in order to receive those services?
Yeah, we actually have a COVID-19 vaccination email address. It's a little bit long, but it is exactly that, COVID-19 vaccination at cornellscott.org. All they have to do
one more time so they can catch it first.
It's just COVID-19 vaccination, all one word, at cornellscott.org. And you can email any kind of question. There's a team of us that answer that email. We've gotten personal questions all the way to, and we will refer you to a provider. We don't give out medical advice, but we'll get you to somebody that can answer your COVID question or set you up with a clinic if needed.
Thank you.
You can also, our website is cornellscott.org. So you can also access our website to link to the information that Sarah provided. And as well, just call us at 203-503-3000.
There's some great information up on that website too. We have a lot of educational resources too that are really for our community. We really tried to make sure that it's quality, good information that is understandable.
You know, and that's why I'm so glad that you all were able to come on this call today, because I want people to know that there is no room for hesitancy when it comes to getting quality health care. When you have people in this community like the Cornell Scott Hill Health Center that has absolutely multiply all the services you can probably think of that you can get in a hospital or any place else, you can get right here outpatient with the Cornell Scott Hill Health Center. And that's why I was so glad that I was able to bring them on the call today to kind of remove a lot of the misconceptions as it relates to quality health care or actually going to receive quality health care. Your health care is so important to the Cornell Scott Hill that they making sure that they trying to innovate all areas of health so you don't have the excuse of not receiving services. That's why in this pandemic it's so important that we bring people like Dr. Robinson, bring people like Mr. Taylor, and bring people like Ms. Killings to the call so you can hear for yourself that it's actually things out there that can actually help you. Dr. Robinson, that makes me think about something about women as it relates to the J&J vaccine, but it also makes me think about, you know, women that are concerned about, you know, when they're pregnant, are concerned about the unborn fetus. Is this kind of, what should they do actually? Could they get the vaccine? Is it safe for them to get the vaccine? Is there going to be any issues that they may be able to think about due to the issue with the J&J, and particularly 6 women that they mentioned and 1 dying from a blood clog? Kind of what would you say in that perspective?
Yeah, so I mean, I would say it's kind of twofold. So I guess I'll start off with COVID vaccinations and women in general. So as you may or may not be aware, but CDC is now actually recommending that pregnant women be vaccinated. A lot of times when it comes to any type of new medication or any new medical treatment, whether that be vaccines or like a pill medication, there are studies that are done beforehand to ensure the safety of them before they're administered to the general population. Most of those studies don't include pregnant women because a lot of times, you know, we know that a pregnant woman is carrying an unborn child and we want to minimize any risk to that unborn child. So when it comes to these clinical trials where they had volunteers get these vaccines before the rest of us had access to them, and we're talking like, you know, these trials had like 30,000, 40,000 participants. None of the people in the trials were pregnant at the time. But what we've seen is that a lot of there were a subset of people in those trials, women who then went on to get pregnant after the fact. And then also when we look at the first like group of people that got vaccinated, where it was older people, but also healthcare workers, there were female healthcare workers in those earlier groups that then went on to get pregnant. And so that was one of the ways that we were able to say, okay, you know what, this vaccine actually does not affect fertility because women who got this vaccine were still able to go on and get pregnant and deliver healthy babies. There's also a pregnancy registry where it basically follows women who got vaccinated against COVID-19, and it follows them through their pregnancy. And it also looked at, okay, well, of these women who got pregnant, and some of them, you know, may still be pregnant, some of them have given birth. Did we notice any differences if we were to compare it to like the average pregnant woman? And one of the things that they did, that they were able to show with these registries, that there was no difference in terms of like having a spontaneous abortion, where sometimes you know, women have a miscarriage, unfortunately, because of something going on genetically with the fetus. So we didn't see any difference there. In terms of like stillbirth, you know, somebody just being baby being born greater than 20 weeks, but, you know, does not survive that delivery. They also looked at the percentage of preterm births. They looked at, you know, the babies that were delivered, were some of them small for their age. They looked at, okay, were there any like, you know, birth defects of the babies that were born? And they also looked at deaths. And so far, you know, at the time of me looking at the registry, there had been no like fetal or baby deaths related to women who had had a COVID vaccination. And so because we have, you know, all this information of women who safely got pregnant despite, you know, or after having a COVID vaccination, that's how we're able to say, okay, you know what, we actually have the data available now that we can make that recommendation, you know, with confidence. As far as the J&J vaccine, so I will say the one thing that's good is that we have, you know, now you can pretty much get a vaccine readily available. In the very beginning, it was like, hey, this is what we have. We have a limited supply, but now we have all 3 vaccines. So if somebody was to say, you know what, I've heard a lot about this particular vaccine, I just don't feel comfortable with it, that's fine. You don't have to get that particular vaccine. You can get another vaccine. So, and when it comes to J&J and blood clots and vaccines and reactions in general. So even though we did not see that type of reaction in the clinical study that was done for Johnson & Johnson, which, like I said, enrolled thousands of people, sometimes when something is so extremely rare, like 1 in a million chance, it takes having like hundreds of thousands or millions of people to receive a treatment before that one rare reaction occurs, which is kind of what we were seeing here. Nonetheless, they were very cautious about it. Let's say, okay, let's just pause things and really kind of look over the data and see if there's any type of similarity between people who had this reaction. And then after reviewing that, we can then, allow people to receive the vaccine, but now we're saying, okay, these are maybe some specific precautions for someone. So for example, if I have a patient who is a woman who maybe they smoke cigarettes or they have a history of having blood clots, either in themselves or a close relative, or maybe they are on medication such as birth control, which may be able to increase your likelihood of developing a blood clot. I may say to that person, you know what, because of these particular risk factors that you may have, maybe it's safer for you to get one of the Pfizer or Moderna vaccines as opposed to this one. This reaction with the blood clot it's extremely rare, but why don't we try this other one just to reduce that risk even more so. And so we have the ability to do that and kind of decide on a case-by-case basis for somebody.
Oh, wow. And I thank you, Dr. Robinson. This time comes and goes so fast. Just as we're getting into this thing, I really would like to take the time to ask you all to kind of leave us. If I left something out, kind of leave us. You got a minute apiece. Mr. Taylor, I want to start with you. What would you leave with this community as we begin to end this call? What would you want to say to help them understand kind of your perspective as it relates to services at Cornell Scott Hill Health Center?
Come in and let us take care of you. We care to keep you well.
Right to the point. Sarah?
Okay.
Pretty similarly, I mean, I know the numbers can be overwhelming and statistics all over the place, but the biggest one that's been all over the place lately is that it depends on which study you're looking at, but 97 to 99% of those that are in the hospital are unvaccinated. So please stay out of the hospital, come get vaccinated.
Please.
Please. And Dr. Robinson?
Yeah, so I would say, my kind of final words of wisdom is that we are now dealing with the situation in which dying from COVID, we have something to prevent that. It's largely preventable through the use of vaccination. We did not have that option over a year ago. And there have been people, I think that both you and I know, and other people in the audience may know, who unfortunately died from COVID and who didn't even have the opportunity to become vaccinated. And so I think sometimes we have to think back to how things were before, and people who may have loved to have the opportunity to have something to prevent them from getting sick and succumbing to that. And so we have to just kind of keep that into perspective. And so that would be something that I definitely recommend. Also, too, we're in a situation where with this Delta strain, there is no kind of, there's also a risk with not getting the vaccine, right? So people think about like, okay, what are the risk or side effects with the vaccination? But there's a lot of risk with not getting a vaccination. And that risk is, getting sick with COVID and becoming very ill. And some people, depending on their pre-existing health issue, possibly, succumbing to that. And so that's what we're trying to prevent.
All you heard it today, very short but to the point. And I want to take the time out to thank my good friend, Mr. Michael Taylor. Good to see you once again. He's actually putting in the work he put in. I'm so appreciative that he took the time out to come on. Sarah, the love is already there for everything that you do in this community. I love you for it. And they right there just for you. And Dr. Robinson, there's not much more I could say for the services that you have provided to the Dixwell community, as well as Cornell Scott as the assistant medical director of that of the overall facilities for Cornell Scott Hill. I love you all so very much. Community, you heard what they said. Go to Cornell Scott Hill and get the services that they provide just for you. Don't stop now. This is a great time because it's here for you to get it right now. Don't seriously happens. Love you all. See you soon. Come on the call on Monday, people. There's going to be a good program coming at that time to talk more about what we talked about today with my good friend Maurice Williams and his panel. We look forward to seeing you Monday at 11 o'clock a.m. Peace.
Gonna be counting blessings, and I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, let's camera action, I'm ready to go. I'm never gonna give up, fall down, I just gotta get up,